Welcome to today's episode of the Be Sure podcast. Living with epilepsy involves challenges beyond seizures, including stigma and emotional impact. However, with the right treatment and adjustments, many people with epilepsy can lead active lives. To help us better understand this, we are fortunate to have a renowned consultant neurologist with extensive experience in treating epilepsy. Welcome, Doctor.
Yeah, good evening. Myself, Dr. Dipti Ranjan Tripathi. I work as senior consultant neurology at Apollo Hospital, Rourkela. I've been practicing here for last 4 years, more than 4 years or so.
Let's start with the basics. What exactly is a seizure and how does it affect the brain?
So basically, before understanding the concept of seizure, let us understand what actually brain is. So brain basically is a conglomeration of numerous cables, which we call neurons, and there are interconnections between these cables, which are called synapses. So in brain there is a regulated flow of signals through the neurons in between the synapse, in which if they work in a regulated way, we generally do all the coordinated activities in a better coordinated way. So if at all there is some disruption in the passage of signals through the neurons, or there is uh, exuberant signals in the synapse, there occurs a disruption of signals, then in that case the patient or the brain behaves abnormally in the form of seizure. So seizure is basically nothing but outsurge of signals in the synapses which causes the seizures also.
What is epilepsy?
Epilepsy basically is a condition in which the patient tends to have recurrent seizures, recurrent unprovoked seizures. There need not be any inciting events like fever, dyselectrolytemia, or any sort of serious infections which precipitate these seizures. But if the patient has an inherent tendency to develop recurrent seizures, unprovoked seizures, then we call it as epilepsy. Two or more episodes of seizures at a gap of minimum 24 hours unprovoked is termed as epilepsy.
What are the different types of seizures and do they affect people differently?
Yes, of course. Seizures to the common people is we see the patient convulsing in the street. That is what the people understand as seizures. But to a doctor, to a clinician, to a neurologist, seizures may present in a variety of ways. Patient may present with generalized tonic-clonic seizures. The commonest seizures we do see convulsing, and all the arms and legs are shaking. The patient's eyes are uprolled. That is the generalized form of seizure. But in other ways, the patient can have a focal movement, abnormal movement of either one single limb, or any sensory disturbance involving a part of the body. Patient may become just unresponsive, not reacting to anything. Patient may present with abnormal behavior, sometimes abdominal pain. All this can be the manifestations of epilepsy and seizures.
I see. Now, can you explain what causes epilepsy? Is there always a known cause?
No, basically, the cause of epilepsy is not known in almost half of the patient. So, literally, it is idiopathic. We don't have a definite cause to ascertain it to. In the other half, there are definitely certain causes like existing brain stroke. There is a head trauma out of which the patient has developed a scar in the brain. Some serious infections, tumors, a few genetic causes, even some degenerative conditions like Alzheimer's disease in late stage. They all can give rise to seizures and epilepsy.
Symptoms of epilepsy that caregivers should look out for.
Yes. So basically, it is very easy for the neurologist to understand whether the patient is suffering from epilepsy or not. But to the person who come in first contact with the patient, like the caregivers or the patient's relatives at home, or the patient who saw the patient on the road, they should all know what a seizure should look like. So basically, I think everyone in their lifetime has witnessed episode of seizure. Has seen someone seizing. So basically, the patient either gets stiffened up, tonic-clonic movement, abnormal stiffening and relaxing movement of the limbs, uprolling of eyes. The patient can have frothing from the mouth, tongue bite, spontaneous urination. That is the most commonest form which we know. But there are other forms like, as I said, patient can have focal movement of either one limb or one finger or half the face. There can be twitching movement of the eyelids. There can be sensory disturbance, loss of sensation or tingling or paresthesia or some burning sensation in part of the body. There can be abnormal behavior. There can be abnormal loss of, abrupt loss of consciousness, or the patient can just become non-responsive. Those are all the different types of manifestations of seizures which you should understand.
Now let's talk about something that many people with epilepsy face: stigma. Can you tell us why epilepsy is often misunderstood?
Yes, of course. So, epilepsy is one of the conditions in which the patients suffer more from the stigma rather than from the disease. So, basically, epilepsy is a disease of the past. It has been known, the disease entity has been known since long ago, but there are certain myths which have been associated since the humanity has understood this disease, but it is often misunderstood often. How people think that he or she is cursed, that's why he's being taken over or overpowered by devil, that's why he is behaving abnormally, but it is actually a disease entity.
Absolutely. Now let's move on to managing epilepsy. What are the common triggers for seizures that patients and caregivers should be aware of?
Triggers, there are certain triggers which the patient and the caregiver should know actually, because these are the factors which can abruptly uh, precipitate a seizure. Factors like lack of sleep, missing regular meals, abnormal undue overburden stress, or missing of antiepileptic doses, using light flashes in the dark, flashing lights in the dark, like using a laptop, TV, or mobile phone in the dark, and certain hormonal disturbances during menstruation in females that can also precipitate seizures. So these are all the commonest triggers which we should be aware of.
Thank you so much, Doctor. To wrap up, could you share some safety tips to help prevent injuries during seizures?
Yes. This is very important thing actually. The onlookers who know what to do and what not to do when you find a patient seizing, either at home or in the road. At home, you can avoid things which can result in injury if the patient develop certain seizures, fall down on the floor. So in that case, you can use soft mattress at home. You can uh, use rounded edges in your beds and tables. You should avoid clutters in your home so that the patient doesn't tangle and fall down. So these are the commonest thing you can do at home. While at road or outside, whenever you see a patient seizing, do not try to move the patient unless and until the patient is in a dangerous condition, such as suppose the patient is seized in the road. In that case, you should take care to move the patient, or else the best thing you can do is just turn the patient sideways so that he doesn't swallow or aspirate the saliva or the vomiters which he has vomited out. That will secure his airways. Try to try not to put anything in his mouth. Just allow the seizure to settle down. In most of the cases, the seizure settle down by itself, so you need not do anything much, but just turn the patient sideways so that his airway remains secure.
Thank you so much, Doctor. This has been incredibly informative and helpful. We hope today's discussion helps listeners better understand epilepsy and how to support themselves or their loved ones, of course. Any final thoughts?
Yes. So basically, what we have discussed so far is epilepsy is a common condition, very much treatable condition. We should not be afraid of it, and there should be so no stigma associated with it. The patient and the caregiver should understand that they can seize at any moment, but they should try and avoid the commonest triggers which have been already been discussed. And whenever any onlooker finds a patient with epilepsy, just remember the basics. Do not forcibly try to stop the patient from seizing. Do not put anything in his or mouth. Do not try to sip the patient unless and until he is in a dangerous scenario.
Thank you, Doctor. And thank you to our listeners. Until next time, take care and stay informed.